Hi, and welcome to Girl Talk. We are here today at Beaufort Memorial Hospital. We are going to be here all day. We are very excited. We have some wonderful guests. Erin Lenz, you are joining us today.
Good to see you.
Good to see you. It's kind of fun. It's
an
early morning for us today. We're joined today, our two guest hosts right now. Maureen Chapman, thank you for joining us.
Thank you for having me.
She is a midwife. We're really excited to talk about this. And Miss Janna Jones-Kersh, how are you?
Good, how are you?
You know what? We talked to you about a little over a year ago now, and she is also a midwife. We're thrilled to talk to you too. And we had to pull some big strings with Beaufort Memorial Hospital today to get you on with Terry because I really wanted to talk to you today. Yeah, I have a daughter who's newly pregnant. We're going to talk about what you all do in midwifery. Before we get started, though, I would like to talk a little bit about your practice specifically that you're in.
Yeah, well, I'm a nurse midwife, and I practice at Beaufort Memorial Hospital OBGYN specialist with Doctors Miller and Benson and Mattingly. We also have a nurse practitioner in our practice, Maggie, and another nurse midwife, Catherine. So we are a growing and ever-changing practice, it feels like, right now.
And I practice with Dr. Pat Thompson and Suzanne Wolf. Suzanne is a family nurse practitioner, and we specialize in gynecology. And our offices are here in Beaufort and down in Bluffton. It's Beaufort Memorial Gynecology Specialists.
Talk to us. Obviously, the difference is delivering babies, not delivering babies. At what point do I make the transition? Or let me ask it a different way. Who are your typical patients and who are your typical patients?
Well, right now, I kind of see a wide variety of patients.
So
I have patients who aren't pregnant, who
Okay.
maybe young women who are coming for their first GYN exam, or women who want to talk about birth control. I see women after they have their babies for well woman care or for pretty usual gynecology problems. And then I even see women into menopause and after menopause to continue their well woman care and, like I said, for usual problems. So I'm doing midwifery from adolescence to post-menopause right now.
Right, and we do have some adolescent patients. I think our practice with Dr. Thompson has more of a menopausal, a population. That's probably our largest.
Just saying.
But it's a great place to come for that, for that focus. So.
You know, one of the things, this is crazy allergy season, and again, we're talking about midwifery, and we're thinking more babies and women and gynecologic care, but you really, and for me, with me, I use you all as a really a primary care. I really do. So it's allergy season. What do I need to worry about with that? Just a little free advice.
In Beaufort, allergies it seems like terrible earlier in the year than the rest of the country. So I talk to women a lot about using over-the-counter antihistamines. So those generally work well for people. I think a lot of people think of Benadryl, which makes them tired and sleepy, but there's lots of second-generation antihistamines like loratadine that do a much better job and don't make you quite as sleepy, and fine for pregnant women too. So that's something I always like to talk to pregnant women about. So if Erin and I do
come in, to you as more or less a primary care doc, can you advise us? Can you do blood work? Can you talk to us about flu shots and really more the broad spectrum things?
Absolutely. And then other things like bone density studies and ultrasounds, mammograms.
You're really treating the whole woman.
The whole woman.
Yeah.
Well, and that's exactly what you said. That your approach from a midwife standpoint. Talk to us about the credentialing for midwives.
We have to go through. Well, first of all, there's two types now. There's the nurse midwives, and then there are certified nurse midwives, and then there's midwives, certified midwives who do not have that nursing background.
Okay.
So they have a baccalaureate degree in the sciences and meet the prerequisites and then go in as midwives. Personally, I love the direction that I went in, and probably you do too.
You do
because
too, with the nursing background.
It gives you a more solid sense of the complete patient, especially when adding primary care, to the practice.
Yeah.
I feel much more comfortable having that solidness. But the others end up getting the same training when it all is said and done. So.
Can I ask you very quickly, at what point in a pregnancy do you like to see a patient come in?
I would say usually we see patients pretty quickly after they have their first pregnancy test. In our office, what happens is they call and get an appointment with one of our nurses who kind of does their intake.
Okay.
And then a couple of weeks after that, we schedule you for an ultrasound to make sure that, based off your period, your due date is lining up, and then you see a provider for the first time, so a midwife or one of the doctors. So that's usually, I would say, around 8 to 12 weeks pregnant.
Do we rotate then, or do I see primarily you?
Yes, so the way our practice works, we try to get you to meet every provider in the practice, because we kind of just rotate call. So hopefully you've met the person on call the night you come in and labor, the day you're in labor, and know who's
really
taking care
Oh,
of you.
I think
Baby
it's
doesn't
so
always come
important.
when you think it might.
Right.
Exactly. We're going to take a quick break, and we're going to come back. If you both can stay with us, we'll talk a little bit about the gynecological portion of midwifery. Stay with us. We'll be back here on Girl Talk.
Girl Talk is brought to you by Custom Audio Video, the Westin Resort and Spa, Buford Memorial Hospital, and by New River Auto Mall. Please support these local businesses as they make this program possible.